am Shayna Thornton, on-air host and executive producer, and I hope you're having an awesome weekend. It is Saturday morning, and we're here with some great educational talk. Today, we are putting the spotlight on HIV, Your Health Matters, and this is an exclusive panel of advocates out there leading the way, educating, inspiring, and motivating us, and we are so honored to have them with us on. Now, you know we have our tradition here on Let's Talk America Radio, where we allow our guests to introduce themselves and talk about the journey that got them here briefly so we can kick off the Q&A. If you're watching us live, we certainly encourage you to get questions, concerns, feedback in, okay? If you're watching us on demand, we certainly encourage you to get your questions in. We always go back and we will connect those questions with our exclusive guests. And tonight we have a panel that is going to motivate you. Certainly, for sure, we have 5 amazing people with us that's going to share. I just want to let you know we have with us we have Winford James, we have April Mckinley, we have Brandy Pinckney Green, we have Sharisha Lewis, and we also have Hermione, and I hope I got that right, Bell with us, and she's going to correct us if I did not. So this panel is your panel, okay? Engage with us. We want to hear from you. That is so important to allow this virtual panel to be a success right here on this April 16th. And welcome to Let's Talk America Radio. We encourage you to tag family, friends, teens, young adults as well, because again, this conversation will educate. We're going to kick this off in due fashion and allow our introductions, our own self-introductions, because Miss April, we've seen the resumes and the CVs, and that's amazing. But we want to hear the journey briefly, 3 minutes or less. Introduce the world to Miss April Mckinley.
Hi, everyone. I'm April Mckinley. I am currently a business owner, and I'm a sister lot consultant. So I'm here in Atlanta. I'm married. That's how I got here. My husband is HIV positive. I'm currently on PrEP, and my cousin just so happened to put a post up one day, and I commented, and she was like, "Hey, come on over. Let's see what we can do." And here I am. So yeah, it's been a journey. But other than that, yeah, no, that's why I'm here.
Thank you so much for sharing, and looking forward to hearing from you today as well. Now we're going to go right now, move right over to Mr. Winford James. I know you're a certified clinical medical assistant. Tell us a little bit about your story, sir. Good morning.
Good morning. Good morning. Yes, I'm Winford James, but I go by James. I've been HIV positive for 14 years, actually. I do community work as far as HIV outreach and advocate for the community. I've been doing that for the last 9 years now. I'm a father of 4. I work at a men's health and wellness center where we do PrEP and HIV management. So that's pretty much why I'm also here as well.
Thank you so much for sharing, sir. We look forward to hearing more from you this morning as well. We're now going to move over to nurse practitioner Brandy Pinckney Green. Brandy, tell us a little bit about your journey.
Good morning, everyone. I am Brandy Pinckney Green. I go by Brandy, as the world knows. I am a board certified family nurse practitioner who stumbled into I call the virus world. I have always been in love with viruses, the study of them. Of course, now my new virus, COVID, I'm also engulfed in studying that. I work full-time for a hospice company, Sacred Journey Hospice in McDonough, and several of my patients, of course, end of life diagnosis is AIDS. And I spend several hours a week here at a men's health and wellness center where I really got inundated with the community and the need for providers to care, understand, and educate the world on something that may have been lost over the years. I know when AIDS and HIV first came out, it was spoken of a lot in abundance in the 80s, early 90s. And I feel like some of that has died down a little bit, but the need for it is still there. It's still very relevant, especially in our community. And this is not just me making things up. This is CDC factual information. where you live at, what you identify as, who you have sex with, communication, medication, all of that will help us in what we in Hermione know as a pandemic still. So that's my why. I'm here to help our community try to end this pandemic.
Thank you so much. And thank you for your work and being a health advocate and getting information and facts out. We certainly appreciate that. Now I want to go over to Miss Shaisha Lewis. Hopefully I got that right. She's a registered nurse with us. All right, yay for me. She's a registered nurse with us this morning. Explain your journey and your background for us.
As she stated, good morning. My name is Shaisha Lewis. I have been in the medical field for 21 years now. I did 16 years at the #1 trauma center in Atlanta, which is Grady Memorial Hospital, where, of course, AIDS, HIV was a part of my everyday care. I will have to admit, I did not realize that how it was still impacting our community. Even as a medical practitioner myself, I did not realize that it was still in an epidemic as it really is, until I started going back on my educational journey and went back to nurse practitioner school, which I'll graduate in a couple of weeks. I actually started interning with Miss Pickney, and I realized that this is something that we cannot just stop talking about. It is still there, it is still prevalent, and it is really impacting our culture, our community, and we need to deal with it and make sure that we're continuing to educate and get the word out there so people will know that they haven't been forgotten and that there is things that they can do to still stay healthy. I think people have been written off. Once they're diagnosed, they just kind of go to the side, and that's not how it has to be.
And thank you for speaking to that, because I think that's so important. And that's a part of the empowerment overall theme of this discussion as well. And that being with this health concern or any health concern. So what do we do moving forward? Because after all, we're still here and we're here for a reason, right? All of us, no matter what is going on. Thank you so much. Last but not least, the one and only Hermione Bell. Hey, hello, Miss Bell. Thank you so much for being with us. I know you're a nurse practitioner. You have worked tirelessly for over 2 decades, from my understanding, working with patients and advocating for patients with HIV. Welcome to the program.
Oh, yes. Thank you so much. And thank you for having me. Yes, my name is Hermione Bell, and I've been a nurse practitioner for more than 25 years. And I have spent most of that time in working, providing direct care to people living with HIV, as well as helping those to prevent acquiring HIV. And so my journey started pretty much when the epidemic started in the early 80s. I was in the military station in Germany, and they started putting GIs out who tested positive for HIV. And so there wasn't a lot of information at that time about HIV and how it was affecting people. And so when they started putting GIs out, just because they tested positive without really knowing all the ramifications, then that's when I started my journey as far as understanding what HIV is, what AIDS is, and how I could help people who were at that time early on were dying from HIV. But now, 40 plus years, we're getting ready to come to that anniversary date of the first reported PCP diagnosis that happened June 5th, 1981. So it's going to be 40 years since this pandemic. And I know people still say it's an epidemic, but it is really a pandemic that affects a lot of people. And so, my focus now is to keep those people as healthy as they can be, as healthy as they want to be, and then finding out, those people who might be at risk and educating them about how they can decrease their risk of exposure or acquiring HIV. So I work with the Ryan White Planning Council, and that's a program that's in every state that provides care and treatment for those who are underinsured or uninsured. So a lot of people don't know that there are resources available for them if they do test positive for HIV.
Thank you so much. And what a great introduction into the work that you have done. And I want to ask my very first question and kick it off to you, because this is a show about education and all of you are advocates and all of you are educated on HIV. But I'm going to venture to say majority of the world is not. right? We hear the term, we hear those acronyms, Ms. Bell, and we just say, oh, okay, well, I think I know what that is. They're not really sure. Will you define right now to us what is HIV, and what is AIDS, and if there is a difference? Because most people don't know. They sort of group the two together. Can you define that starting off, and how exactly do individuals get diagnosed with it?
Yes, HIV stands for human immuno. Oh, am I on mute? Oh, okay.
We can hear you.
Human immunodeficiency virus. And so it's a virus that can cause AIDS. AIDS is acquired immune deficiency syndrome. And so that's when someone is diagnosed with AIDS if they have a T cell count less than 200. And the virus attacks T cells in our bodies, and T cells are types of white blood cells. And so when your immune system is under attack, then you don't have enough T cells in which to fight off any other kind of infections that you might have. And so when T cells fall to a certain level, fall below 200, then that would give someone a diagnosis of AIDS. And so those are the difference between the two. So someone who is HIV positive does not necessarily have AIDS, but someone who has AIDS is definitely HIV positive. And so how HIV is transmitted, it can be transmitted as a sexually transmitted disease. And sometimes some of the verbiage that we use, we talk about STIs and HIV. HIV is an STI, a sexually transmitted infection. And so, we need to start talking about that, like we talk about gonorrhea or syphilis and things like that within the community. And it's transmitted also mother to child during pregnancy. And then it can also be transmitted if a woman breastfeeds her child, if the woman is HIV positive, is found in breast milk. And so the main body fluids that you find HIV is in blood. And so any blood to blood contact that a person might have is a way in which that can be transmitted. Some people think that if you hug someone, you kiss them, shake their hand, eat after them, those kind of things, HIV is not transmitted that way. Sometimes even with police officers or some members of authority, when people spit on them or bite them, they think they're going to be exposed to HIV. And that's why HIV is sometimes criminalized in a lot of states here in the US. But you need at least the 5 gallons of spit for somebody to acquire HIV. So I just wanted to dispel that myth that it's not, you need a whole lot of saliva to get it.
Thank you for clearing that up, because I think there are a lot of questions people have. And I will say this for those that are watching us live on Facebook or you're watching us on demand. If you've ever said, I really wish I had a panel of experts to ask a question to, this is your time to do that, because facts matter. Education is key, not urban myths, not things that your girlfriend or your homeboy or somebody said that's probably not rooted in all science or truth. This is the platform for it. And so excited this morning and honored to have a conversation, a frank and sincere conversation about HIV. And thank you so much, Nurse Practitioner Bell, for all of that information. Very, very helpful. Brandy, you also are a provider, nurse practitioner. You work in the arena. Ms. Hermione said a lot there. And she said it's transferred sexually. It can be mother to child. It can be through nursing. The most common way, I'm assuming, is through sex. Is that correct?
Yes. According to the CDC, the most common way is through sexual contact. And it is documented. Heterosexuals, but heterosexuals also get HIV. However, the homosexual population, men who identify with themselves as MSM, men who sleep with men who sleep with transgender, African-American males in Fulton County, those numbers are at a higher level than some other counties, but that does not leave anyone out of the fact that they can get HIV.
And we want to talk real talk, right? Because it's about educating people in a real fashion. So when you say sexual contact, people will say, well, that's through intercourse. Is that only through intercourse, or are there other ways to also for people to contract HIV?
So HIV can be transmitted through the anus and vaginal contact. Oral sex, no, you cannot. It's one of the STIs you cannot get HIV documented with oral sex. However, a man on man anus, man and female anus, a man and a woman vaginal, yes, those are all methods in which you could transmit the HIV virus. Now, let me talk about the other STIs, since those are my bag as well. I've been seeing a lot of gonorrhea and chlamydia in the throat. I don't know if people realize oral sex, you could get STIs as well. And Shaisha has been here with me in the clinic on a number of occasions in which we have diagnosed gonorrhea and chlamydia orally, and people mistake it often for a simple sinus infection. And it's not until someone like me who's seasoned in STIs actually do a swab and get the culture and say, oh no, this is not a sinus infection. This is actually chlamydia or gonorrhea.
And I want to ask you, Brandy, the importance of getting diagnosis. I mean, be it HIV, AIDS, gonorrhea, syphilis, topics that make a lot of people in America uncomfortable about, because and I know there's a notion for many people like, well, it will pass, right? I've got a little pain, I got a little arthritis. Maybe there's something going on with the sinus care, but it will pass if I just wait it out. Talk to us about the importance of staying empowered with your own health and not assume everything will just work itself out because you're saying it with your mouth and you're saying, I'm speaking it, that it's going to be fine. But to actually go in and see a provider and get that diagnosis and get the treatment you deserve so you can really be in the best position regarding your health.
I think the first thing we have to address as a community, African Americans, being from the South, is that medical diagnoses are very fearful to some. And knowing your sexual activity, knowing your behavior, the thought of I possibly may have HIV, I possibly may have an STI because I did something that I know I should not have done, that sets people back months. You have to get out of your own way often. What do I mean by that? I tell my patients all the time, get out of your own way. You cannot worry about what society is going to say if you want to live. You cannot worry about what your parents, your sister, your brother is going to say if you want to live. And living means I start with prevention first. So prevent things from happening to yourself, not just with HIV, PrEP, and PEP, but also with other medical diagnoses. If you know you have a family history of heart failure, diabetes, get the preventive measures before you have to do treatment. And then once you pass the prevention, which means you know you have the virus, you have the chronic illness, you need to be treated. Now you have to own your health. You have to own the diagnosis. You have to say, I have to do what's best for me. And you have to put blinders on to society. And that's exactly what I tell my patients that are diagnosed with HIV often. I said, I will do as much as I can to help you fight the stigma. Being diagnosed with any chronic illness has stigma. I have patients diagnosed with cancer and they need their family and they won't say one word because of the stigma. I don't want anybody to know. I don't want anybody to see me this way. And that's not how I feel patients should live the rest of their lives. Own your diagnosis. And we all know there's consequences, right? We've all had situations in which we've had to suffer consequences. And in this case, we have to own them in order to live a better life.
Wow, what great information. Thank you so much for sharing that. And we've got some feedback from our chat box of saying own it. And they really, really appreciate that. And I think that is key. I want to address information or topics on this discussion specifically that's going to empower us. And I want to go to you, James, and because you are an African-American male who you're very effective at advocating. Your testimony is really inspiring because you're about trying to get as many people educated as possible. But I do not need to tell you as a Black man in America that there are some notions when it comes to health with Black men that are out there, right? We all hear the statistics that women tend to go to the doctor or provider more to get diagnosis for whatever reason. Maybe it's because women have babies. I mean, there are lots of reasons you can get into that, but a lot of men sort of push away, or when it comes to getting diagnosis or getting their health, it's the macho thing. I'm fine, there's nothing wrong. Talk to us as a Black man in America, how important it is to take hold of your health. And for those men of color listening to us right now, and all men, or and every woman that's willing to listen as well, but specifically addressing men of color and not to avoid the provider's office because they may not want to hear a diagnosis.
Yes, yes. A lot of African American men are afraid of what people might think or what people might say about them if they're diagnosed with anything. And a lot of Black men get sick and they avoid the hospital, they avoid the clinic, they avoid everything because they feel like they can take care of themselves, which is a big issue because a lot of men walk around with STIs or cancer or a lot of illness and not know because they're afraid to go to the doctor or they just don't want to go to the doctor. A lot of men don't feel like they have to go to the doctor if it's not serious. If they feel like they're not dying right then and there, they feel like, oh no, I'm not going to the doctor. I don't have to go to the doctor. I kind of went through that growing up. But when I was diagnosed with colon cancer and I had HIV at the same time, I think I put my foot down and said, look, I have 4 kids. It's time for me to take care of myself. I was determined to be healthy for my kids. I was determined to be healthy for myself. I knew it wasn't the end of the world. In the beginning, I did. I felt like when I got diagnosed, I was gonna die like the next day. But when I got educated on HIV and AIDS, I knew then, I was like, okay, it's time to go check on myself. It's time for me to check on my body, see how my body is functioning, take my medication, and just keep pushing forward. To any Black male out there that is watching and that is listening, it is very important for you to get checked on, to go get your checkup, because you can. A lot of people could be sitting right here with colon cancer like I had, and I didn't know that this whole time I was unable to use the bathroom. I was suffering with colon cancer, and I've been suffering with colon cancer for the last 6 years. Last May was my last surgery. It'll be May 18th to be a year I've been in remission from colon cancer.
Congratulations to you. Very excited to always hear individuals beating cancer, and we're making strides in that area. We're going to continue the conversation, but I want to focus on you because you are the only male on this panel. So very unique and special, and we applaud you for that. When the male get into the provider's office or sitting in front of them, and I think this is so important to address because I've talked to so many providers and those who are supportive of providers, those registered nurses such as Nurse Lewis and those medical assistants and the physical therapists, and they'll tell me these things, and then they get in front of a provider and they get quiet and everything's fine, nothing's the matter. Give us some helpful tips briefly on for that male who may have grown up like you and so many men around the world that you just don't complain. You just kind of you kind of deal with what you deal with, and maybe they've been told, many people, and this is men and women, have been told you don't tell other people your problems. But when you're in the comfort trust zone of a provider, that is key. That's a special relationship. There is no provider running off and telling people what's going on, but how can they navigate that conversation as comfortable as possible? I'm not saying it's always going to be a comfortable conversation, James, but you and I both know maybe there's some tips they can do, maybe perhaps go in with some questions written. I mean, what can they do? Bring somebody they trust with them to help. How can they make sure that visit is successful and not check the box? I went in, but I didn't tell the doctor anything about maybe the activity that I'm doing or things that the physician or provider may say, let's run some tests.
I think a lot of people don't know about HIPAA. And when they do know about HIPAA, they get comfortable where they know, okay, I can talk to the provider. Because I have some people come in the clinic and I ask them what's going on and what they need to see the provider for. They'll tell me one thing, and when they get in the room with the provider, they'll say a totally different thing than they told me because they're not. You have to make someone comfortable with coming in. See, it goes back to say a lot of African American men are not comfortable telling someone else like me, myself, another African American male, what's going on with them. But when they get back to the office or get back into the room, they talk to the provider and let the provider know everything that's going on. I'm just like, okay, that's not the same thing they told me. So when HIPAA comes in play, they understands that, okay, I can open up to the provider and let her know everything that's going on with me without her judging me, without her telling my business, things like that. So I always let people know when they do come in, it was like, I have some questions for her. I said, when you get in the room, just open up and let the provider know everything that's going on with you that you need her to know so she can be able to help you, because you can't help someone if you're not open about what's going on with your body or with yourself. So if you open up and let someone know what's going on, then they can help you. Legally, you can't expose or tell somebody's business. That's against the law. That's why we have people sign forms, HIPAA forms, so your business is not disclosed or sent off to anyone else. And a lot of people don't know that, or a lot of people, oh, I know what HIPAA is, but they don't really know what HIPAA is. That is basically a law. We cannot provide anyone with your health status or your health information. So you're comfortable with, you can get comfortable with talking to your provider and let her know everything that's going on with your body. It's very important for you to open up to your provider so she can help you.
And that is so, so true. Thank you so for eloquently pointing that out, that it's no conspiracy where people are just, and sometimes people get that in their head. I mean, and you are important. I do want to say that to everybody watching us, but you're not to the point where that medical team is waiting for you to come in and for them to share and blast your information. Nurse Lewis, I want to point this to you because as a registered nurse, you have worked tirelessly for many years, helping all patients in different arenas. How important is it for patients, as James pointed out to us, to really be upfront and honest? Not just when they're talking to you as a registered nurse, but also when that nurse practitioner, physician assistant, or MD or DO comes in there as well. I mean, help us make that bridge.
To be honest, it's as important as basically life or death. If the provider doesn't know everything, there could be a misdiagnosis, that could be a wrong medication given, that could interact with something else that's already going on. So it's very important for patients to realize that providers have to treat the whole body, meaning you may come to me and say, I have a headache, but in order for me to treat that headache, I need to know what you had done to your foot last week. So I don't do anything that's going to cross over and cause you more harm than what you're already going through. I don't think people realize that it's really that important. It's that important to be honest and say what you've done, what you've taken, whether it's legal or illegal, or whether it's something that you're ashamed that someone may know. Again, we're obligated to keep your information between us, to treat you, to make you better. We're not going to call your mom, your friends, your cousins. This is between the personnel that's in the room to make sure that you live your best life. Everybody say they want to live their best life. That's what this is about, living your best life. So when you leave us, that you can truly do that.
I love that. And what so many great buzzwords and phrases coming out of this virtual conversation here on Let's Talk America Radio this Saturday. But live your best life. You're right. Let's really own those words, right, Nurse Lewis? Not just sort of say it because it's trending and we hashtag it. But living our best life is also being honest with ourselves to be able to say, even if it's uncomfortable, just like James said, just like you said, Nurse Lewis, even if it's tough, we've got to put ourselves in that position to take ownership of our life, because it is our life. And as many providers have always said, nobody's going to care about you like you, right? Nobody will. I know you had your hand raised, Miss Hermione, really quick. Did you want to share something as an acclaimed provider treating HIV for decades?
Well, I just wanted to just co-sign to what Brandy and James both brought to the table, because it is really important that you are upfront and honest with your healthcare provider as well as the healthcare team. It's like James is a very important part of that healthcare team that a person has, and as you had said earlier, that sometimes a patient might feel more comfortable talking to one team member as opposed to talking to the doctor. But if the patient also knows that they have a team of people that are working with them to help them to stay as healthy as they can be, then that's, we're going to find out about it anyway. It's not like we're telling your business or anything like that. This is about the whole healthcare team that's there for you to be successful in your healthcare.
Yeah.
Such a great point. And I think so many times we talk about diversity and having identification for children to be able to relate to teachers, right, that look like them, because that empowers them. I think that's just as important in the medical community, right? It probably, if just as, if not more, because it's key to say, well, I can see a male, I can see a Black male like James, I can see someone that looks like Nurse Lewis, and whoever it is. So that maybe for some people, that may be the comfort level they need. Not for everybody, right? I mean, I'm not saying everyone has to be necessarily have a provider that looks like them, because by all means, I know that there are physicians that are wonderful, or nurse practitioners that are wonderful, and physician assistants that are wonderful, from every ethnic group, right? We know that. But it is, I think, there's some power in seeing individuals that perhaps sometimes that you feel you can relate to, because I think you're going to get the most out of it. And I think we all can agree that what we want from the medical community is gaining the most to be able to save as many lives as possible. April, I want to turn my sights to you now, because we did speak with James, and I know you also are living with HIV. You are a woman, you're an African-American woman. And I think, and this was touched on by nurse practitioner Brandy earlier, there are people that have a notion in their mind or a concept of who is living with HIV, right? It's clearly, it's not always based off of factual information, but they would say, well, here is a woman. They may say, well, how come that's not true? And I've heard things out in the community where people don't believe that women and heterosexual women can contract HIV. Will you tell us how important it is to recognize and realize that we all are in this together? It's not one notion of who you think may have and who may be dealing with it.
Oh, yes. So of course, as a Black woman, heterosexual Black woman, you don't think that you can get HIV. Yes, you can. It is very possible. Like they said, you need to talk to your provider. That's the main key. When me and my husband went to our provider, we got diagnosed. He was positive and I was negative. So immediately our provider was like, okay, well, let's get you on PrEP. And as soon as I got on my PrEP, I felt more comfortable. They educated me more about the virus, so I wasn't terrified thinking that, oh, I'm going to catch it, or my husband's going to die, or something like that. You really need to educate yourselves, guys. It's so important to have that education, to know that it's not as, I can't say it's not as bad, but it's not like you're just kill over and die and you can't live a happy life. Me and him we're fine. I mean, he's been undetectable for the last 2 years. We still have intimacy. I take my PrEP, he takes his medicine. But in our community, it is very, very important to educate yourself, to go get tested and get diagnosed, and know that it is. I'm with Brandy. I'm with all the rest of the nurses and nurse practitioners and advocates. It's important to go get tested, know your status, be educated, and grow from where you're at. Like, it's a serious pandemic out here as far as HIV in our community. It's not very talked about. A lot of people are ashamed and afraid of it. I had to pretty much convince my husband that, look, it's okay. Like, I'd rather you sit there and, I have more problems with him not going to work than I would have him being HIV positive. I mean, it's not a statistic that's like, it is so bad out here. They judge people so badly. And it's sad because of the fact that's why they don't want to go to a doctor. That's why they don't want to sit there and be honest with their doctor. They're afraid that somebody's going to judge them. And it's not until pretty much so it's almost too late that they finally like, okay, I'm going to go to a doctor. I'm going to go see what's going on. And then they're like, okay, well, this is what's going on with me. And sometimes they just give up, and it's really sad. And that's why in our community, we definitely have to sit there and start going to the doctor, start being more honest with ourselves, our sexual partners, and making things happen in our communities.
And thank you so much for your testimony and your honesty, because I think in that right now we're getting great feedback on our chat, our live chat. You are empowering someone out there, because I think there's a notion as well when people say, well, I'm in a relationship, I'm married, or I'm dating, or I'm living with someone, and I don't have to worry about being tested. I don't have to be concerned with going to the physician or a provider. And there are people that think that, right, in their minds. And I think your testimony is such a reminder, again, for all of us to take our own health in our own hands and be empowered, because we may not know. And I love that you're saying that, you're saying that there may be a stigma associated with it, but we've got to find the strength to remove that and do what's best for us. I also love the fact that you're saying that you and your spouse went to the doctor together. Elaborate a little bit more on that, how key that is, because there are millions of households right now in the US, around the world, where they're like, okay, we can share paying the rent together, we can pay the electricity bills together, we can pay on the kids playing basketball together. But there are many couples that are loving couples, right? Healthy couple in terms of the relationship, where they're like, but when I go to my doctor, I see my doctor and I see my provider and he sees his, and that's it. And sometimes, there are relationships out there, Miss April, where they're not talking about even that the doctor or the provider diagnosed them with hypertension or type 2 diabetes or lupus. I mean, that some people, once again, it goes back to what we discussed with James. That's kind of my business. I love him or her, but that's got what's going on with me is going on with me. But we do need to be having an open conversation about health matters with the people we love, especially in the same household. Would you agree?
Yeah.
Yeah.
Totally. Me and my husband, I go get tested every 3 months anyways. Long story short, my twin sister had a situation where she was exposed to HIV. And since then, this was probably 2 years prior to me and my husband dating, I go get tested every 3 months. If you're out here having sex, I tell you now, go get tested. Don't be crazy. Go get tested. Prep, if you know your lifestyle, you know what you're doing. That other person might not know, but you know. And if you want to take care of yourself and your health, go get tested, know your status. Me and my husband was together for probably a year and a half, and I found out that he prefers to sleep with transsexual women, as well as, cisgender women or born dyke, or I don't know what they call it nowadays, but women born as a woman. And first thing I did was like, okay, well, let's go get tested. Men have it bad when it comes down to their sexuality, regardless if they're gay, straight, bisexual, whatever it is. And that is a big problem as far as men are concerned, because they just like, okay, somebody's going to judge me. Somebody's going to say this about me. So it took me forever to finally get him to the doctor, and he wouldn't have gone without me. So I had to make him comfortable enough to know that it's okay, that I'm here with you. We got married, better or worse, thick or thin, health through sickness and health. And we went in together, and he was terrified. He was telling me, I'm just scared of, the diagnosis. And honestly, I think he already knew, or at least had an idea in his mind. And of course, I went first. And like I said, I go every 3 months anyway. And then when he went, of course, it came back positive. We immediately started going to AHF here in Atlanta. They're great providers. I had great people around me. I had a counselor who was like, you can still have your, happily ever after. because I was devastated because I'm thinking I'm going to lose my husband because I wasn't educated. I didn't know. I was thinking, just like James was saying, that he was going to die within a week. I just did not know. I was not educated. And to say that all my family is in the medical field and stuff like that, you would think I would know a little bit, but you don't know. And until you know and educate yourself, like you really, you do put people in a stigma. You do sit there and get scared and not sure what, to think. And I understand that. We went, he tested positive. We got, our treatment, we got our counseling, and we're just happy now. We don't have the issue of, I don't have to worry about, okay, is my husband out here contracting, STIs and stuff like that, because he's with me. We're on our medication. We go to our provider, regularly. We get tested. I still go get tested. I have to in order to stay on PrEP. So that way I can make sure that I don't contract HIV. But it's so important, like I said, to educate yourselves. So that way you can be happy both with your family as well as, other loved ones, because they don't know. It took us a while for my husband to finally tell his mom, to tell his favorite cousin who, looks up to him, his best friend. And when he finally did that, he was so relieved, because he was like, it's because of you that I can actually sit there and just be myself. I was like, right, you don't have to hide who you are because of the fact that you like something different, or you have this, ailment. I know people who have cancer, who has, like she said, diabetes and stuff like that. They take medications every day, 4, 5, 6 different types of medications. It's all about taking care of self and making yourself healthy.
Such a great testimony, great information. Thank you so much for sharing all of that, because this is the human component to anything that's going on regarding our health. And it's real people, real talk, giving you real information that will. Brandy, I want to go to you right now, nurse practitioner Brandy, about, she spoke of PrEP, but before we do, let's talk about how important it is for everybody to really know their status, because she pointed on something. When you're married, enter what you believe to be a committed monogamous relationship, you feel that you may not need to be tested for HIV or AIDS. From your viewpoint as a nurse practitioner, do you recommend that even married people or committed people get tested as well?
This is such a great question for me, because I get it all the time. My patients always switch the question around to me, and they'll be like, well, you married? Do you take PrEP? Do you get tested for HIV? Why are you so adamant that I do? And this is one of those own it kind of questions, even for myself. Own your lifestyle, own what you do, own the communication between you and your spouse, own the behaviors of your spouse. Don't ignore what your spouse is doing, and vice versa. And it goes back to communication and monogamy. So if you are married, if you both communicate heavily, if you both have said, I commit to you, you commit to me, not because we're married on paper, but because I said that and you said that, and we both work hard at it, and we continue to be monogamous amongst each other. I'm not seeing any signs that I'm ignoring in him, and he's not seeing any signs that he's ignoring in me. Yes, you can then make an elective decision and say, I don't need to take PrEP per se. But it's nothing wrong with doing an HIV test yearly minimum. Just like there's nothing wrong with getting doing a self breast exam, or having getting your pap smear done, or doing a stress test if you have cardiology problems, getting your A1C checked if you're diabetic. There's nothing wrong with just knowing. So yes, I'm a married woman. Yes, I'm in a committed monogamous relationship. But yes, I do get yearly HIV tests. I do. No, I'm not on PrEP. That's just a decision I made because of us. But another couple may come to me, may give me a totally different story. They may be okay with a swinger lifestyle, no judgment. They may be okay with their husband sleeping with someone else on occasion. They may be okay with their husband sleeping with another gender. Some people want to marry the opposite gender, but may want to have sex with the same gender. No judgment, but the facts are, yes, those kind of people may need to be on PrEP to prevent HIV from getting into their bodies, or if they're already diagnosed with HIV. What I love about April and her husband is that they are honest with each other. They're communicating. They have owned the mistake of the marriage and they have moved forward together as one. They went to the provider. Now that we know the mistake that he's made, we're going to own it. We're going to own the reality of our future because we want to live. What do you do from there? He takes his medication. He becomes undetectable. Undetectable, you equals you. If you're undetectable, you're untransmittable. A lot of people don't know that fact. That gives you a sign of, oh, okay, well, if he's undetectable, April can now feel better that her husband cannot transmit it to her, as well as the fact that she's on PrEP, right? Pre-exposure. That means I take this pill every day and I prevent myself from getting HIV if I come in contact with the virus. So now she has a double wall to protect her from the virus. And now I tell her, now all she got to do is work on her marriage. Don't worry if you got the HIV diagnosis covered. You guys did the work. You did the counseling, you did the provider, you did the education, you did the work on being diagnosed. Now do the work with continuing the marriage kind of thing. So it's a loaded question, but yes, there's nothing wrong with getting an HIV test yearly. And whether you take PrEP or PEP or not, is totally your situation.
Yeah, and thank you so much for explaining that. And we're getting some great thumbs up and feedback from you about your comment about couples need to be honest, right? And that's the real issue here, right? It needs to be, and even like you said, based off that information, if he or she believes it or not, right? That there's nothing wrong still moving forward with knowing your status. I would think that's important for everybody, I would think, and then making the decision if you need to be on PrEP or something like that to be able just to ensure, because like we keep saying, own it. That's the most important thing. Miss Hermione, I want to go to you right now because we keep throwing around the word PrEP and we keep saying, it's out there. Many of us have seen the commercials, no doubt, but can you really explain how this medication works? Does someone have to be on it for the rest of their lives? And I want it to be full transparency because we want to make sure we're balancing our view. If it's for everyone, and for those individuals that you're aware of that it may not suit, and if there are any known side effects, because we always want to be balancing our view here on Let's Talk America Radio.
Okay, so PrEP stands for pre-exposure prophylaxis. So it's a preventative medication and a behavioral health modification approach to decreasing the risk of HIV transmission. And so the medications that are prescribed, it's a combination tablet of two medicines. One is called Truvada, although they now have a generic form of that. And then the other one is Descovy. So most people have been seeing the Descovy commercials on television now because the company that makes both of those medications, they tend to use the Descovy more often or push that more but that is only for men and for transgender women. Truvada is for women who were assigned female at birth and identify as female. So that's, I think April had brought up the term cisgender. So cisgender is a woman who identifies as female and who was assigned female at birth. And so with Truvada, it's pretty much the same two medicines that are in the Descovy. And the difference is that the Descovy tenofovir that's in there is less toxic to bone and to the kidneys. And so when they tested in cisgender women, it wasn't as effective. And so those medications, that's why there's Truvada for cisgender women, and then the Descovy is usually prescribed for men and then transgender women. The side effects of those medications is side effects of any medication, even if people take over-the-counter medication. The first things I always tell people is nausea, vomiting, and diarrhea, because that's the system you take it in. You swallow it, goes through your stomach, all those things. So sometimes people have GI side effects. And so those are the main ones. And then, as I said, these medications sometimes can affect bone and kidney health. So there are some lab tests that every time someone comes in for their PrEP visit, they get an HIV test because PrEP is only for people who are HIV negative. And so you have that HIV test, and then we do tests on your kidneys and your liver function, and maybe get a blood test just to make sure that there are no side effects you might not feel any side effects physically, but they might show up in your blood. So those are the things that are monitored on a regular basis when someone is on PrEP.
Thank you so much. What a great explanation. One of the best explanations I've ever heard about it, because you're right. When you see the commercials, and sometimes marketing can take a different approach than what's facts. And we have providers on that's explaining that. So key. I want to ask you this as we begin to wrap up this important conversation, virtual panel about HIV. Miss Hermione Bell, nurse practitioner, worked over 2 decades working to advocate tirelessly for HIV patients. You've seen a lot, and you mentioned at the top of the hour when we started this program in the 1980s and where we are and where we are today with it. From your professional viewpoint, have you seen a difference in terms of patient care? I mean, I'm going to say this just being non-medical, that when we see some solutions that are helping, such as the drugs you just mentioned that are being advertised on television, it seems like we've jumped leaps and bounds of it. But you're on the inside working. Have you seen a lot of progress? And I'm not just talking about on the research science end, but also on the patient end, and how well we're reaching patients and saving as many lives as possible.
Well, yes, yeah, I've been doing this for quite some time, and I did start out in research exactly when some of these medications were not even commercially available. And what we found at that time, we call it pre-HAART, so highly active antiretroviral therapy. So before we started using combination therapy to treat HIV, we saw a lot of people dying with HIV. And so around 96, 97, we had what we saw, the phenomena of the Lazarus effect, like people coming back from the dead, because we started using these combination of medications in which to treat the virus. So now you have people living with HIV instead of dying. It's not to say that people are still not dying from HIV/AIDS complications, but they're not dying like they did back in the 80s and early 90s. People are living long, healthy lives. They have a normal lifespan. But then by the same token, the virus, what we've learned about it over this time is that it's an inflammatory virus, meaning that it's always turned on. It's always causing some inflammation in the body. And so when you have inflammation all the time, then that can lead to other things such as diabetes or heart disease and things like that. So that's what we're finding out now. So yes, people are living longer with HIV and living healthy lives, but they might be at risk for acquiring some of these things that are age related as we get older. The heart disease, things like that might be happening a little bit sooner. So a good healthcare provider would recognize that, and to help minimize, start talking to their patients about lifestyle changes. It's hard for anybody to change certain habits that they've had all their life. And we drill into people all the time about quitting smoking. I used to smoke, so I know how hard it is to quit. But that would really do a whole lot for someone who's living with HIV and their cardiovascular health, as well as the inflammation that HIV causes. So quitting smoking would do tremendous things for someone living with HIV. So, as we have evolved, we're finding out all of these different things, but people are healthier, I think, than early on in the days when we first found out about HIV. But now we're finding out different things that, may be an effect of the virus itself and also from the treatments.
Excellent information. And I want to end my last question for you as we go back around to the additional panel members. We see the commercials and we hear the chatter, and, we've made so much progress in terms of HIV and AIDS. One of the concerns, and I mentioned this pre-show, for individuals out there, we don't though want people to get almost reckless though, and I know you would agree with this, to just assume, well, people, and you said it best, people are living longer. I mean, by now, most Americans know individuals that are living with HIV and AIDS that are living vibrant lives. But how key is it still in terms of education and prevention, how key is that part to you as a provider who's worked in this for years and years, for people to still stay empowered with education, and thankful for the progress, thankful for the medications that are out there and other therapies, but also to say, well, just don't say, well, there's something for that, so I don't have to, I'm just going to still do behavior that may not necessarily always be as responsible, for those that are knowing and empowered.
Yes, and that is a challenge that we still face, with people acquiring HIV, because as I said earlier, it's going to be 40 years in which the first PCP diagnosis was reported in 1981, and you still find patients. I just had one just the other day who tested positive for HIV. She told me that she knew that she probably had it, but she had never been tested before. And so I asked her, what made you get the test now? And she said, because she's ready to do it. And so it just kind of made me go back to when you see people who have just, are younger than 40, who are in their 20s. This disease has been around since you've been on earth, and you still were exposed. So what education are we not doing? And I think some of the early approaches that we had when it was believed to be in just certain communities who were affected, that we left some communities out. And so when we're talking about HIV in the Black community, we need to talk to Black folks, how Black folks are, speak to each other and that kind of thing, and how to use family within, some of these diagnoses. Because if a person feels like they're all by themselves and they don't have any support, and yes, they might come to a clinic that supports them and that kind of thing, but family is real important to us, not just the family in which we were born into, but sometimes the families that we acquire as we go through life. So it's really important that we need to identify some other ways in which educating people who are most affected acquiring HIV, that we, learn from them. And just one last point that I wanted to make, and I think a lot of people have brought this up. When you go to the doctor, prepare for it like you would prepare for anything else, any other appointment that you had. Those 15 minutes that you get with that healthcare provider, you want to make sure it's the most that you can get out of those 15 minutes, because that's your time. It's not their time. We need to change some of the things in the healthcare industry to meet the patients where they are and not always have the patients come to us, because sometimes we assume things if you don't share, but prepare for those appointments like you would prepare for anything else.
Yeah, such a great point, such good information. Thank you so much for being on with us. Nurse Lewis, I want to ask you the last question for you, at being a woman and being an RN and work with so many different patients. But this is a relatable human side of it. For someone watching right now, they're saying, okay, I heard everything all these advocates and providers said, and that's wonderful. I heard James, I heard April, I heard Hermione, I heard Brandy, but they're saying perhaps they're in a relationship, or believe that they're in a relationship, and he is telling me one thing, or whatever, she is saying one thing. So I'm going to trust what they're saying, right? They're telling me that, and if say it's someone saying, well, she said, there's nothing to worry about, right? I'm sure as providers and those advocates, you've heard that many times. People say there's nothing to worry about, and there's that human component in people that want to believe that, right? Especially, and everyone on this panel, I'm sure, has been in love, right? You can attest to this. When you're in love, you want to believe what that person is saying. Help us out as a registered nurse who worked in different areas of medicine. How it's important, no matter how much what someone is telling us, when it does come to STDs, STIs in general, that woman or man has to really have some control and decision making in that. And I would imagine, I want to say this as plain as I can, not give all of that control of your life and your physical health to someone else. Help us out.
I'm going to circle back to a couple of points. I think Brandy talked on communication and knowing when you're missing something, knowing when something is not right. We all do have that human component, that intuition that we have, that something's not right. We use it all the time. I shouldn't go to the left. I should go to the right. I know there's traffic on 75. I'm going to take 285. So if something's telling you that something's not right, believe it. I'm not telling anybody to go home and attack their spouse. I'm not saying that. I'm saying, listen, look, question. And at the end of the day, you are not responsible for what anybody else does. You're responsible for yourself. So if you're not sure and you feel like you're looking, questioning, and it's still not right, you still have to do what's best for you. Educate yourself, know your status, and protect yourself. Just because we believe we're in a monogamous relationship, that does not mean that condoms don't come into play. And I think people have forgotten that condoms are still there. They're still needed. You know, if you're in a committed relationship and everything is open and you're communicating, then that's something that you and that person can talk about. But if you're not able to talk to your spouse, you're not even able to have a conversation with them about it, that says a lot in itself. So you have to protect yourself. You got to live your best life, period. That's something people say all the time. So if, not saying that you're preparing for your next relationship, but if you want to wake up tomorrow or 3 years from now and still be as healthy as you can be, you have to start today, which means knowing and owning what you do, protecting yourself, regardless of what the next person or the other person does. And we have to come back to that in our lives and really be responsible for us. That's where it starts. It starts with, regardless of who you're with, you still have control over you.
Thank you so much. And you hit it right on the nail, because that is so true, right? I mean, and I know we've talked a lot about this, but condoms was not mentioned. And thank you for really closing in on that you've got to really be invested in you. And you're right. And that's the hard part of life, that sometimes we don't want to think of a future without the person that we're so committed to right now, being a spouse or a partner or loved one. But you're right that at the end of the day, you have to be invested for you. And I love what James said earlier. And James, I'm going to go to you right now. When you were even talking about your colon cancer diagnosis, and I think this is so key. If we can't, and this is, I'm saying this not necessarily what you said, but if we can't find the courage for ourselves to go into the provider, maybe we need to find the source of inspiration. And for you, you mentioned your kids. You said, I have kids, right? I mean, if we have kids or we love our mom and dad or someone depends on us, we've got to take it there. We've got to say, but don't they deserve for me to be here 3 years from now? And that's so key. James, you have shared so much with us this morning, and just truth and facts, and we appreciate all of your advocacy. My last question for you, and it's a great question. What would you tell someone listening right now that they're saying, well, I probably should go to the provider and try to figure something out here, but I don't know. I have faith, right? Let's go there, right? I've got faith that all is going to be well, and I have prayed about it. And personally, I will be open. Shayna is a person of faith, right? But they're saying I have faith, and I'm going to pray about it, and all is well. What would you say to that person? And not knowing if you're a person of faith or not, but I do know you work in the medical community, and I know you would. I'm guessing you would probably advocate for them to do what's best for them. And I want to say this: faith and science are not enemies, people. I do want to say that, because a lot of people assume sometimes it is. James, take it away for us.
Yes, I would always I would tell someone you have to love yourself first. And if you love yourself, that means you love what happens to you, what happens to your body. You want to know what's going on with your body. So I always tell them, just be comfortable with who you are. The first step is loving who you are, to be able to accept who you are. You have to go in, make sure your body is taken care of, make sure your health is up to par. There's nothing wrong with going to the doctor at all. At first, like I said, I was afraid to go to a doctor a lot of times because I didn't want to hear certain things. But when it came to it, and I go to the doctor now frequently, I love now to hear that I'm doing well, I'm undetectable, I'm in remission, like different things like that. It's good to hear, knowing how your liver is functioning, how your cholesterol is. All of that is something I like to hear now. Like I tell a lot of guys that come in here, it's important for you to know how your body is functioning. Who doesn't want to know how the body is functioning? how their health is, because you can wake up the next day and be like, oh, I didn't know this or I didn't know that, because you didn't open up or you didn't go in to get yourself seen about or checked out. And then I wanted to put this out there as well. A lot of people think that having HIV is it's all about sex, or oh, he sleep with a man, he gonna have HIV. Like my case is totally different. I was attacked and raped by a white officer. That's how I contracted HIV. I wasn't even sleeping with guys at this point in time. So my situation is totally different. Everybody don't just go out sleeping with men and contract HIV, or sleeping with, different sex or same sex, and it happens that way. Some people contract HIV totally different than just going out and saying, oh, I want to have sex with someone. I didn't ask for it. I didn't go out. I wasn't dealing with guys then. I was attacked. That's how I contracted HIV. But I owned it when I found out that I had it. I was scared, but I started going to the doctor and checking on myself, because I knew I had to live for myself, and not only live for myself, for my kids, but you have to love yourself. That's number one. When you love yourself, that means you'll go in and make sure everything that is going on with you is taken care of. So basically, I would make sure, that's the number one thing for me, is loving who you are to be able to go in and see about yourself.
I love that, James. Thank you so much for sharing, and we're getting some applause on our live chat. Love yourself. And I think everything you've shared this morning is reminding us to love ourselves. And thank you for sharing what your journey as well, because I'm sure it's inspiring and empowering someone out there. And that's the point here that we're trying to achieve. Miss April, I want to go to you. You've shared so much as well. I want to close with you about courage. And I say that because courage is one of my favorite words, and I think it comes in different forms. Sometimes we can find it in young children, elderly people, whoever. And maybe they may say, well, I haven't been courageous all my life, but there are moments in our life when we are. And when I heard your testimony, when you were talking about making sure you're taking care of yourself and facing the provider and getting diagnosis, I kept saying, this is courage. This is what real adulthood looks like, right? It's not the easy things. It's not the comfortable things, but sometimes it's addressing the elephant in the room. Talk to us right now, for maybe there's a young woman watching us, and she may be excelling in other areas of her life, but she's questioning that step to do what's best for her. Help us out, because being a human being on this earth longer than 2 years, right? That sometimes the best decision or hearing the best news may not seem right in that moment. But a year from now, we look back and said, look how far I've come because I have the truth. Help us out with courage.
Yeah, be courageous. Take control and just do the right thing. That's all I can tell you. Like I've written a book about it. I've got a YouTube channel now. I try to speak out about it a lot. So, and it wasn't easy. Like you said, it wasn't easy to tell my story or, write that book or, get over certain facts and things of my relationship. But my dad always says, if you're still breathing, you will eventually get over it. And it's true. Time heals all wounds. You will get over it. You can do this. You can make a difference. I tell all people, it doesn't matter, color, background, you can make a difference. Even if you just reach that one person, at least save that one person. And that's why I do what I do. I definitely advocate for being tested. You're right, we didn't mention condoms, but definitely if you're out here having sex, use condoms. They protect you from all kind of STDs, STIs. Go get tested, educate yourselves, guys, and have the courage to live your, like she said, best life.
I love that. Thank you so much. And your truth. So there's someone watching us, and your truth can be someone else's courage. And I think that's exactly what you and James have proven to us and all of our advocates here. Miss April, we do have some individuals inquiring about your book and your YouTube page. And I do want to, we'll close up on that as well, but can you provide that now for those that are interested in connecting with you?
My book is called Married in Atlanta, Living with HIV. My YouTube is April G. Mckinley. You can see me on there. I'm going to post on there, of course, this podcast and share everything after this as well. And like I said, guys, y'all encourage your family and loved ones to love themselves and go get tested and be courageous. It's okay. It's okay.
Yeah, it will. And you're so right. It will certainly, like your father said, as long as you're here, you still have a purpose, right? You're still breathing. You
Right.
have to push on. You've got to find those resources, the village, the network, the organization, the right provider, whoever it is to help you, encourage you on your way, because you are of value. You are somebody. And if you don't know it, if you're having a moment right now, whoever you are, wherever you are, if it's HIV, AIDS, if it's diabetes, if it's depression, you do matter. And your time is now. Just believe in it and keep pushing. Miss Brandy, I want to close with you, but first I do want to address a medical question that did come up. I do not want to miss this. Someone asked us a while ago when Miss Hermione had said about inflammation and what we know about HIV and AIDS. They said, they asked the question to you, so will natural anti-inflammatory methods help with that response? That's a good question. I mean, I guess this is just, preparing our bodies in general. And you all know, you and Miss Hermione and also James know, working in the medical community, and Nurse Lewis, that so many diseases feed off inflammation, right? There's even been some connection with COVID, living off inflammation, and sometimes it's tied to obesity as well. But Brandy, that's a relevant question. Any support on that? Any natural remedies?
As of now, there is no natural, and Hermione can back me up on this as well in her experience of 25 plus years. There's no natural remedy to prevent you from getting HIV. Yes, there are natural things in which you can prevent overall decrease in inflammation in your system. That's proven, some herbs and things of that nature, but that decrease in inflammation will not prevent you from getting HIV if you come in contact with it and you're not on a PrEP. And Hermione, you want to speak to that as well?
Yeah, and I wanted to say that some of these things are still being studied. We're learning about different biomarkers in the body that can tell you about the inflammation. And so it's still being researched. We don't have a lot of information about it, but I don't know of any natural remedies or anything like that. It's just pretty much keeping everything else in check. If you do have diabetes, to manage that well, some of these comorbid conditions that we have that's associated with HIV could just make that worse. It can make the diabetes worse, being HIV positive, make your high blood pressure worse. So controlling those things that you can modify, because once someone's HIV positive, they're going to be HIV positive for the rest of their life. But these other things that come up, those things can be controlled and managed, and could possibly be cured, so to speak.
Such a great point, and thank you for sharing with that. Brandy, my last question for you, as Miss Hermione just pointed out, we're decades in. It's almost 40 years since that first diagnosis of HIV came into that was known, that was diagnosis, that was clinically documented. And she said, many people call it an epidemic, but Ms. Hermione said it's still to her very much a pandemic. And you know this, and I know this as a provider, and I've interviewed you about other topics before. One of the things that the medical community is always big on, be it diabetes, be it cancer, is try prevention. Now we know there are things sometimes that that's not avoidable, that we know will still be there. But on the prevention side of this, can you wrap us up and share with us? And I know you would agree, and all of our advocates would agree, we want as many people as possible to live and live quality lives. And I think it's also realistic to say that we want as many people as possible to also avoid a diagnosis of HIV or AIDS. What would be your closing advice for prevention? We know there's hope there. We know that. We know, all of us know, it's some people that are vibrant, that are living and moving on, and they're sharing their testimony and they're educating all of us on it. But in terms of prevention, what would you say to that 25-year-old that's listening, to that 38-year-old that's listening, to that 55-year-old that's listening, and to the 73-year-old that's listening as well? Because this is a health concern that impacts everybody, right? We know that, male or female. And that's just the truth of it. People want to hear that or not. If they want to just put in their mind that that's only something that affects men, that's only something that affects women that are under 30 because of the lifestyle they're living, it's not true. So help us out.
I would say to anyone living in America, South America, the Caribbean islands, Europe, Asia, it's a pandemic because all humans are affected by this virus. And in that same aspect, you are human. You deserve care. You deserve to be treated appropriately. I would say find someone, whether it be a family member, a friend, first to confide in. Have that person also tag team with you and find a provider. Providers are key at this point in the race. When we are past the baton, we have to do our role as well, developing that relationship in which we empower our patients to let them know you are human first. If you tell me what's going on, I'm going to do everything I can to make sure you are empowered to own your health. Once you are at a step where April is and you can own your health, you can then help others. Reach one, touch one, help someone else, then get to the next level. When you're at the bottom, you may not know. When you're in the middle, you're still trying to figure it out. When you're at the top, you can then reach back and help someone else. This is not just an American pandemic. This is not just a Caribbean pandemic. It's not just in Asia. It's not just in Europe. This is a worldwide pandemic that has to be addressed. And everyone has to own where they are in this process and help someone else so we can end it. I'm very convinced with research and more time that HIV can end. And why do I want it to end? Because at the end of the day, HIV can lead to AIDS, and AIDS mortality is what people are afraid of. We forgot to mention that. So HIV, what are people afraid of? They're afraid of dying from AIDS. Like, let's be clear with that. We don't want to see our family member die from AIDS. I don't want to treat another patient that has AIDS. And in order to prevent that, I have to prevent HIV. Get rid of it, just like we got to get rid of COVID. And then it'll be another virus we'll be fighting after that. But that's another story.
We are so thankful.
So that's my why. That's the purpose.
I love it. I love it. And we are so thankful for you and Hermione and others that are giving all they can in the fight for so many different health conditions. Brandy, will you share your contact information with us as well as we go around before we close out? Because I know so many people have been educated and inspired by all of you today.
Yes, I am Brandy Pinckney Green. I'm a board certified family nurse practitioner. I work at the Men's Health Center here in Atlanta. James and I are here today. He's my medical assistant. 2140 Martin Luther King Boulevard. We have two providers that work here. When I'm not here, we have another provider. We have an MA here Monday through Friday, 9 to 5. We do HIV testing. We do STI testing. I also do PrEP and PEP treatment. We are very, very easy to access. James takes DMs all the time. I also take DMs all the time, direct messages through Facebook. And my Facebook is Brandy M. Pinckney, as well as my Instagram. And James will give you his information as well, and our contact number are here.
Awesome. Thank you so much for all of your education and wisdom, especially all the nuggets you provided for us today. James, I want to go to you. For those that want to reach out or learn more, I know she mentioned the clinic you all are out. How can they reach out?
Oh, yes. They can also contact us on our email. Contact on our email. It's menshealthcenter.org. You can get information about the clinic on there. You can email us. You can contact us at the office as well at 404-609-3197. And again, this is a men's clinic. So any men looking to be on PrEP, looking to get in care, STI testing, this would be the clinic for you, or any females that want to help their husbands or their brothers, sons come and care with us to get on PrEP. And if they need any more information about PrEP, they can contact us, and we can get Brandy to enlighten them on PrEP.
I love it. Thank you. Information is key. Empowerment of everyone. And thank you also for pointing out that village support. You're saying if there's a woman, her nephew, her brother, whoever it is, certainly encourage and share this information. And that's exactly what we want you to do here in the live chat as well. Just tag anybody who wants to be informed about health matters. And I would hope that would be all of us. Ms. Hermione, for those that want to connect with you, such a great educator, explains so well. I love it. You take the most complicated subject and you make it look easy as pie, easier than the ABCs as the pre-K and kindergartners would say.
Wow. Yes. Again, thank you for allowing me to be here. Again, my name is Hermione Bell. I'm a nurse practitioner, been a nurse practitioner for more than 25 years. I opened my own practice last year called Bell Primary Care. It's here in Atlanta. I have an office at 285 Boulevard Northeast, Atlanta, Georgia. You can contact me at bellprimarycare@gmail.com, or you can call my office. It's a mobile line, so 404-337-7486. And I provide primary care for anyone, primarily adults. I am trained as a family nurse practitioner, but I strictly treat adults. So anyone above the age of 18. I also provide gender affirming care for those individuals who are transgender, male or female, and then just a complement of care for your overall health.
Thank you so much. Congratulations on your new practice as well. Well done. And so Nurse Lewis, for those that were inspired and empowered by all of your information, thank you so much for your real talk and adding that medical side to it as well, which is a great marriage of a sort, right? That helps as many people as possible. How can they connect with you?
Again, my name is Shaisha Lewis. I am a registered nurse, soon to be nurse practitioner, following in these wonderful women's footsteps. They have really encouraged me and enlightened me, even myself today. I think we forgot to touch on that. Even people in the medical field still have to continue to educate ourselves as well. We are constantly learning and figuring this road out along with the patients. If you don't do it every day, if that's not your area of expertise, you have to continue to read up on these things. So when you do come in contact, you're ready. I do have a home companion care company, so I can be reached at homeangels123@gmail.com, and on Facebook at Home Angels Companion Care, if anybody would like to get in touch with me.
Thank you so much, and congratulations to you on all your success as well. And as I would say to all of you, keep it going. She is last to provide the information, but she did it before. We're going to do it again. She's certainly not least. Miss April Mckinley, will you tell us again how they can connect with you on this groundbreaking book you wrote? And also, I hear you're a popular YouTuber.
Yeah.
Yes. So you can reach me at April G. Mckinley on YouTube. The book is called Married in Atlanta, Living with HIV. I also am a sister lock tician. I own my own business. So if you're looking to get your locks done, you can reach me at 404-416-3083. You guys have a great rest of your day.
Yeah. Thank you so much. What a great program today. Thank you everyone for joining us. It was I'm just going to say an amazing program on this Saturday that we had. We had a frank, sincere conversation about HIV, and it's something that's needed to be addressed in all communities, but especially communities of color. We are in 2021. There's been so much that's happened, but HIV and AIDS are still being diagnosed, okay? And so information is key. And if you're a parent, if you're a guardian, please take this information and find a way to communicate it and connect it to your young adult in your life, be it a teenager, an adolescent, adolescent, because information is powerful. Don't always rely on their friends, because you know friends have that influence on them, for them to tell them untruths or urban myths or things that they just want them to believe. Let our youth, our young children be empowered with facts and truth so they can take care of their health. It's so many of our advocates on this panel said today, own it, own your health, take care of it, because no one's going to love you like you. Thank you for watching Let's Talk America Radio. If this was your first time watching us, we thank you. We welcome you to continue to join us weekly. We continue to have great information, great topics. We'll be back on tomorrow night at 7:30 p.m. Eastern Daylight Time with another conversation about finding the best you inside, getting over emotional trauma. I've got an expert on with me, and she's going to break it all down, and she believes that you can continue to be your best self, but she says you have to acknowledge some facts first. So we're going to address that tomorrow night. Join us. If you can't watch us live, watch it on demand. This episode will also be loaded to YouTube. Follow LTA Radio out there on YouTube, Instagram, of course, Fabulous Facebook. We're on Twitter, LinkedIn, wherever you are getting information on social media, we are out there. We cannot thank our panelists today enough. Thank you, thank you, thank you, James, Hermione, thank you so much. April, Brandy, Nurse Lewis, thank you all for all the information, for sharing your truths, being transparent. That takes courage. I recognize that, and I thank you for doing that. But I do believe that your testimony, your courage is inspiring someone right now. Perhaps they're going to call their provider next week and go for that test. Maybe they're ready to say, I'm ready to do what's best for me, so I can be here as long as possible. And whatever you're living for, your mom, your dad, your kids, or your own future, your own success, your own business, it's yours. Certainly own the information. Thank you for watching Let's Talk America Radio. Stay with us for additional information. Visit ltaradio.com. That's ltaradio.com. Stay connected with us, and we appreciate you, okay? Stay safe. Continue to mask up. COVID is still out there. Numbers are creeping back up. As many of you know, this new UK variant in the United States is taking a hold. So please be safe and make the best decision for yourself. Thank you, LTA family.